Well, the HSE is involved in CAWT as a partner agency of the overall CAWT organisation. We're partners with all of the boards and trusts in the north, and as part of that process a number of projects were selected under the INTERREG funding, and the social inclusion project was one of those. The benefits for the HSE is in terms of tackling health inequalities, social exclusion for the targeted or for the marginalised groups across the border region, who are even more marginalised because we live in the border area. So it's very much a focus on improving health and inequalities, and also access to services, and also to mainstream these services in the future, so that what we have done and what we've tried to achieve through this project will keep on going into the future.
The reason the project started is because of the undeniable links between exclusion and poor health status, and the connection between those and health inequalities. And then in particular, our project has its origins in, I think, really good work that has been happening and has been happening for the last 10 years by statutory and community and voluntary sector organisations to try and tackle exclusion. And an awful lot of what we're doing is building on that and expanding that to new geographies and to new groups of people. And we've been lucky enough, as a result of the EU INTERREG IVA funding, to be able to deliver on a three-strand project, and each strand is discrete, but over the life of the project we are knitting the three strands together, and hopefully that people on the ground see that it's better when programmes are delivered on a cross-border basis. One, they can be more accessible for people, but secondly, that there can be more of them because it's cost efficient to do things for a border community rather than delivering in two separate locations.
We target the Mullaghmata area here because it is where the main element of travellers live. It's the main network where travellers are living. The Mullaghmata has about 178 houses in it, and 50% of those have a traveller background. It is where the All-Ireland Health Study took place, and it has had no training in this area for travellers before. There's no accredited training being given. And the area that we're working with in Cambridge, Mullaghcreevy, Katy and Dungannon in Armagh is a very similar background to the Mullaghmata area here. Initially we were hoping to hold a similar course to the primary healthcare course, and we were sort of told, yes, primary healthcare course was good, but we want to do other things as well. We just don't want to work in health. We want to be hairdressers, we want to be community development workers, we want to be tutors, we want to be van drivers. So we then changed the programme to accommodate this. The programme has been running since October, and we have 8 participants here in the Monaghan area, one of whom is from the Southern Trust area and who is a male. The other 7 ladies all come from the Mullaghmata area in Monaghan here.
When I first started it, confidence was very low, but from I've been in it, getting to know others and getting into a routine, my confidence has come up. Well, we were doing interview skills, team skills, you know, and we're also doing maths, which is fractions, decimals, percentages, which when I was younger I never got the opportunity to do that, and now I have the opportunity and I love it. Well, my hopes is to bring this further and hopefully get on another course for community development, and then try out MIFIT College. I want to become a fully qualified community development worker.
The way I work when I am engaging with travellers is I would visit the travellers in their own home. I would build up a rapport with the travellers. I would look at what their needs is, and their needs may not always be looking for a job. Their needs may be totally different. But it is building up that trust and relationship, and it's building it up with the whole family.
I was kind of a bit iffy about the whole travel thing, and I says I'm going to do it because the opportunity mightn't come again.
We really need travellers in to give their voice and their views, and the only way to do that is for them to become part of the workforce. They have so much value to give, and for so long they've just been overlooked.
Well, I know that the women's groups, the women that are accessing the training programmes and everything else are much more aware of where they can access services. They are more aware of their own health and well-being and how to access the services when they're required. The focus on travellers within that aspect of the project the travellers were building their self-esteem, their confidence, so that they will then sustain their own ability to access services going into the future, and their families as well. So a lot of the people that we're working with, they are saying very positive things about the project and wanted to continue, and are also very keen to participate further into the project as well.
I suppose impact is what it's all about, and what everybody wants to do is to be able to say that, look, we made a difference. And I know for all of us working on the project, the one thing we would love is that for the women who come to our programmes, that they have a sense that their life is different in some way, that if you're living in a domestic violence or if you're living with cancer, that the isolation and loneliness that sometimes those circumstances can create has been overcome in some way by the bringing together and the delivery of the particular programmes that we do.